Welcome to Podcast 83, a regular look at the news, stories, and trends related to Michigan's 83 counties from the Michigan Association of Counties.
Good afternoon, everyone. Welcome to Podcast 83, the podcast put on by the Michigan Association of Counties. Today, we are joined by Rich Carpenter from Rehmann, one of the premier partners of MAC, a strong supporter of counties across the state. Rehmann's one of our inaugural premier partners. They've been involved with MAC for the past year, and not just involved in MAC, but in counties across the state. So before we kick off, Rich, on the behavioral health component, which is really what we're going to focus on here in a minute, why don't you talk a little bit about Rehmann, what you guys are doing statewide, and how you're helping counties?
Absolutely. Thanks, Steve. So, of course, Rehmann has been in the government space for a long time. We've got 80 plus years serving individuals and governments within the state of Michigan. We are doing the most county audits actually across the state. So that gives us a unique perspective in terms of what different counties throughout the state are dealing with in their local communities. So we have that audit perspective. In addition to that, we're also providing a lot of outsourcing services for different municipalities, including county government. So whether that's temporary to permanent finance director or CFO services, or all the way to full finance department support if is needed, depending again on the community's budget and the community's need. So we have been fairly ingrained in Michigan counties for a long time. And that really introduced me about 15 years ago into the behavioral health space. As we'll talk about in a little bit, behavioral health used to be one of the services that counties provided directly. There's actually in the chart of accounts, general chart of accounts, there is a mental health fund that's still referenced, even though many counties don't have that anymore. But that's really kind of dove us into behavioral health, and we've gotten really kind of in depth with it. So
yeah, let's talk a little bit about that, because there have been a lot of changes over probably the past 20, 30 years to behavioral health and counties' involvement in behavioral health. Like you talked about, a very involved component to still involved, but maybe in a different way. Let's talk about the history of behavioral health just briefly, and then we'll kind of get into where you guys are seeing things moving going forward from where we're at now. Because we even had some issues a few years ago that there were some initiatives from the state level that were pushed that never got enacted.
Absolutely. And the history is quite, it feels quite long ago. And I feel like a historian sometimes trying to dig up where the past has brought us from. So if you really think back, a lot of the big stuff started actually in the 60s. So in 1960, the federal government passed a mental health act that really supported the idea of community-based behavioral health services. At that time, they focused on mental health services, and as we'll talk about, substance use disorder services got pulled into that as well. The state of Michigan also passed an act that kind of gave the counties the ability to start providing behavioral health services directly within their community. Prior to that, it was primarily a state funded or a state provided service. Some counties were doing it on their own. They saw the need for that, but they passed the act that really allowed that to start getting funded from the state to the county level. In the 70s, then the Michigan Mental Health Code was actually enacted, which standardized care, or at least began to standardize care across the state, and really gave the counties the ability to go forth and provide what their citizens needed. And from there, it just kind of morphed slowly over time to the system that we're in today. In the late 70s, early 80s, the state started to close a lot of the state facilities that were providing a lot of those services in an institutional perspective for the consumers or for the patients that were being seen, and really wanted to transition those individuals back into the communities. And that's where the counties really started picking up both that responsibility, but also the benefit of being able to keep those individuals in the community, but then figuring out how to manage that in the other services we provide. So.
Yeah, and it's a huge, important topic. You guys obviously see it from a very financial perspective, obviously, with your work within counties. I hear about it, when community mental health, behavioral health comes up at any of our board meetings. It's a hot topic to this day. Obviously, there's still funding gaps. There are gaps in care throughout the state, and our counties are kind of at the front lines of it because it is in their communities, and they're trying to help these folks across the state. So as we start to move into today and going forward, what are some of the ways counties are kind of addressing the issue going forward?
Yeah, and it's very interesting. So there are 46 community mental health services programs across the state of Michigan. And so, as you know, there's 83 counties, as the podcast name suggests. So some counties are partnering with other counties to have a singular program that meets the needs of their citizens within their community, and some are a single county community mental health services program. And as I'm sure a lot of your listeners and your viewers would know, every community is different. And so the way that the community mental health service program partners with the county is going to be different everywhere. Whether it's in the jail, whether it's mental health courts, whether it's drug courts that may be in place to help, again, support these individuals, it will look different everywhere. That being said, there are some kind of consistent themes throughout, right? The consistent themes that we're seeing today is wanting to break down the barriers between the substance use disorder services and the mental health services. So while they are under the same funding model currently, there's still a difference in how those services are delivered. So there's ongoing desire to make that a more streamlined process, a more seamless process. We're also seeing new opportunities for funding. So more grants that are coming through related to the state opioid response dollars. So there are opportunities there for the counties to partner with their community mental health services programs to, not duplicate necessarily how some of those dollars might be getting spent within the community. So that's an area that's of I would say utmost, or I would say not urgent, but it's very relevant currently in terms of what are we going to do with maybe some of the opioid settlement dollars. And then recently, CCBHC, which stands for a Certified Community Behavioral Health Clinic, is a new federal designation that can be received by a community mental health services program. And it brings even more federal dollars into that community to enhance those behavioral health services. And so there are opportunities potentially for a county to partner with their local program to see if those dollars would be valuable to the community.
Yeah, as you start talking about strategic partnerships, obviously, there's those county to county partnerships that can exist, especially when you start looking at opioid funds and combining funds, maybe not duplicating services like you mentioned, through different locals. Township cities are getting opioid funds as well. They can partner with those folks. Are there any other partnerships, strategic partnerships that you guys have seen that have, maybe some best practices that you've seen in other counties that you would recommend?
Oh, we've seen, sometimes we start talking about on the border between counties with the community mental health services program, just identifying the best way for the citizens to access services. So we see partnerships between sheriff's departments, between counties that might help manage individuals that might cross county borders to make sure that they're aware of the mental health or the behavioral health needs of the different citizens, and so they can get them connected back to the support system within their county. Again, the community mental health service programs should have both children and family services as well as adult services and then those substance use disorder services. So knowing who the right people are to contact, depending on what response law enforcement or other emergency services might be responding, and being able to connect them. We've even seen really good partnerships with mental health first aid training that some counties are getting very involved in with their community mental health services programs, so that their first responders are ready to identify and respond to those emergencies that might include a behavioral health component. So again, there's a variety of opportunities there throughout the state.
Yeah, I think you touch on a good point there, and that's identifying those issues, on the front end, whether it's the sheriff's, department, when the sheriffs pull somebody over and if there's an issue, not just putting folks that have some sort of mental health crisis right in the jail, right? That's not the right place for them. But and getting them trained properly to what do we do with them? Do we take them to a hospital? Is there another option? How about jail diversion programs? Have you seen, can you speak to a little bit about maybe some of the jail diversion programs or drug courts that are out there that have helped in counties?
Yeah, I mean, from a funding perspective, that's where my expertise lies versus the details. So I'll talk to what I know
Sure.
and understanding that there's probably three layers down into the details. But we do see opportunities where both our state general fund dollars at the community mental health services programs and our Medicaid dollars, and I can't stress that enough, our Medicaid dollars can help individuals stay out of jail or stay out of incarceration, if we can get the services and supports into the community. So the idea being there that we identify early that there's a behavioral health need of the individual, work closely with the court system as well as law enforcement to say, is there a safe and appropriate plan for this individual where we can keep them in the community and out of incarceration, right? Obviously, very important that the individual stay safe and the community stay safe in that process, but identifying what that safety plan would look like, how it would be implemented, and then potentially reduce some of the burden on, again, on the law enforcement and or on the corrections facilities that might otherwise need to serve these individuals. So we've seen a lot of, again, different results in different communities on how well they want to accept these types of programs. But there are a lot of examples out there that others could talk to that have seen great results, and sheriff departments are very, very happy. I know one example, we work in Monroe County, and the Monroe County administrator talks a lot about how well that jail diversion and the jail services program works between the county and the community mental health services program.
Well, and it sounds like there's funding options out there, right? It doesn't just have to be general fund. We already talked a little bit about opioid settlement funds could potentially be used in these programs, Medicaid dollars, any other funding options that you've seen that could help counties with these?
Absolutely. So there is access through the Michigan Department of Health and Human Services in what they call the community mental health block grants, and they have it's still called substance abuse and prevention and treatment block grant dollars that can flow through, that sometimes have a match requirement, sometimes don't. And so depending on the specific program, a little bit of county dollars can go a long way to add funding into the community to help address the treatment and prevention needs of these individuals.
Yeah, that's great. Anything else that you maybe want to touch on that we haven't touched on yet that you've seen across counties that may be helpful?
I mean, I would say from my perspective, again, when I look into the future, what are the hot things that I would recommend people kind of keep their ears open for, keep their eyes on? Number one, the Community Behavioral Health Clinic in the state of Michigan is putting a lot of dollars into that CCBHC program. It does have both a county and a non-county component. So we are seeing a little bit of, what I'll say is private, not-for-profits that are trying to get into that. There is the opportunity that depending on the community that will, it could actually complicate care. And so I just share that as something to be aware of, that you may have to not only be coordinating with your community mental health services program, but with other CCBHCs in the community. So that's something to keep your eye on. I'd also just, again, can't reiterate, the Medicaid dollars that flow into most communities represent 95% of the behavioral health care that happens in a community. And it is allowed to support some of these jail diversion programs. We can't use it on individuals that are already incarcerated, but we can use it to help prevent that, that need up for the correction system. So when we look at situations, and I know you brushed on it a little bit earlier, like the 298 initiative that happened a few years ago, if those Medicaid dollars were ever not managed with the public behavioral health care system, those Medicaid dollars would not be able to be directed to some of those community programs that really are beneficial for the county. So we just want to keep that in mind as we think about some of the policies and the direction that the state is headed and how we want to advocate for that.
Yeah. Yeah, very helpful, Rich. Thanks for your time today. Thanks for Rehmann's support of counties across the state of Michigan. I think a great resource for our folks out there should they need it. And thanks for your time today.
Absolutely. Thanks, Steve.
Thank you for listening to today's episode of Podcast 83.